Everyone in the room. It's for all of us, and you are encouraged to access it. It sets out specific requirements for all of us. It clearly states that health service provider boards are accountable under LHSIA to engage with system partners, seek out integration opportunities, and to manage governance and oversee operations. You have an accountability to do those two areas, which are no small feat. What is integration? This is how the Act defines it. It is to coordinate services and interaction between different persons and entities, improving accessibility of health services to allow people to move more easily through the health system, improving the match between the services provided and the needs of the client, making the healthcare system more sustainable and accountable, promoting service innovation by enabling effective and efficient use of system resources. And integration happens on a number of levels. It can be on a governance level, for example, through a partnership or merger. It can be an administrative, sharing back office processes, or it can be on the service level, such as the implementation of best practices, coordination of care. These are some of the approaches for integration. Certainly by providing or changing funding, this is subject to the terms of the Ministry LHIN Accountability Agreement and the Service Accountability Agreements between the LHIN and the health service providers. A facilitated integration involves one of our providers and facilitated or negotiated by the LHIN. It could be about integration of entities or service. Voluntary is integration activities voluntarily initiated by health service providers. Required are when the LHIN or the Ministry requires health service providers to provide or cease to provide services or transfer services from one location or health service provider to another, and ordered by the Minister. And the integration ordered by the Minister is highlighted here. After receiving advice from the LHIN, the Minister may, if considered in the public interest to do so, order a provider that receives funding from the LHIN and that carries on its operations on a for-profit or not-for-profit basis to do any of the following on or after the date set out in the order. So cease operating, to dissolve or wind up operations, amalgamate with one or more health service provider that receives funding from the LHIN, or transfer all or substantially all of its operations to one or more persons or entities. These are the expectations we have of health service providers in the Southwest LHIN. To be aware of the LHIN Integrated Health Service Plan, provide leadership, identify opportunities for integration, to work collaboratively, and I think this is very critical that we want you to be working with other health service providers within your area. Engage the community, again, a critical piece. Give notice of voluntary integration to the LHIN, comply with the LHIN integration decision, and be accountable to the LHIN and community for the outcomes of the integration activity. Considerations in structuring integration decision-making protocols. These are the things we would look at. Does it align with provincial strategic direction? Is there public accountability and transparency? Has that been a part of the decision-making? And of course it will be going forward. Cooperation and shared responsibility among communities, providers, LHIN, and government. Will be supported. Consistency in the decision-making will be promoted, and decision-making will be evidence-based. These are the questions we would ask as we move forward with an integration decision. I don't need to read them all to you, they're in your handout as well. Just so that you are aware that when an integration takes place, these are the questions that will be coming forward. This slide highlights the evolving roles of boards in integration. And you can see that the LHIN board will provide the strategic leadership to health system integration. The provider board provides the support of the organization for the LHIN system integration. The LHIN leads community engagement, but so does the provider. Establish LHIN decision process and criteria for integration initiatives in context of the IHSP. The provider has a similar responsibility, and the others are outlined there for you. These resources are available for you to access to help help you as you move forward. They're what the resources we've relied on, and they're available for you as well. This is what our website looks like, and you can see where the resources are available on the site. There's a red circle. You can see that there's a link to the Governance Resource and Toolkit that was launched a year ago and was a joint initiative of several provider organizations and LHINs from across the province. We aren't always reinventing the tool. In fact, we try very hard to link into other available resources to ensure that our staff resources are utilized to maximum effectiveness. So that's a very quick, much faster than I was last time, race through that. And I know there's a lot of detail in there. There's a lot of information that you will want to think about moving forward. At this time, it's an opportunity for you to ask questions as we move forward, questions that might be how the impact on your governance or concerns. This is your opportunity to share with us as a LHIN board so that we know what challenges you're facing. But it's an opportunity for you also to share success stories in terms of integration, so that when we move forward, we know that there are other supports out there, and we can perhaps learn more about our partners as we do move forward.